Good afternoon, ladies and gentlemen. I am delighted to be here in Sigatoka to open this new extension to the hospital, where a great deal more Fijians will enter the world in the coming months and years. It's always a special pleasure to improve facilities for the most important people in our lives, our mothers. They are the backbone of our nation and of course deserve the best we can give them. And unfortunately here in Sigatoka, they have not always had that here. But from today, all that changes with the new maternity unit. That is a wonderful addition to Sigatoka and Nandrongan, and of course wonderful improvements in the conditions we can provide for our women during the most important experience of their lives. All over Fiji, my government is working to improve the standard of our hospitals and healthcare centers to provide the Fijian people with the best possible standard of care that a country like ours can afford. Earlier today, as I had mentioned, I had the great pleasure of opening a community health center down the coast at Voreqe, and tomorrow I will be opening another center in Zoo. To open 3 new or refurbished facilities within a 48-hour period in Nandrongan alone is ample evidence of my government's commitment to improving the healthcare standards of our people. And I'm especially delighted that this facility in Sigatoka is such a wonderful example of the partnership we have forged with the private sector as we work together to improve the quality of the care, both for our people and our visitors to Fiji. And I want to say how grateful I am to the Fiji Hotel Association, the Coral Coast chapter, for joining with us in this in building this wonderful new facility. This hospital not only caters for about 50,000 people within the Sigatoka Hospital catchment area, but another 5,000 or so tourists who are honored guests at hotels along the Coral Coast. This new extension is a public-private partnership between the government and of course the Fijian Hotel Association through the Board of Visitors at Sigatoka Hospital. And I thank you for all that you've done for us. Of the hotel cost of the 2.6 million spent on this project, the Hotel Association Coral Coast chapter has contributed $600,000, with the rest provided by the government. And I want to thank the association on behalf of every Fijian, and especially the people of Nandrongan for that contribution. I also want to pay tribute to all the other stakeholders in the project: the Ministry of Works, the Ministry of Health, the Office of the Commissioner Western, provincial officials, and the contractor, Cope Construction. To all of you, this new maternity unit health center and health office comes on top of a range of other developments at Sigatoka Hospital over the years, including an eye clinic, a dental clinic, an accident and emergency unit, and the refurbishment of the hospital wards. About 100 babies are delivered every month, and a similar number attend the antenatal care clinic as we prepare our mothers for their important day. So everything about this new facility is designed to make them more comfortable and give them the best possible care. We all know that the best possible start any baby can get in life is to be breastfed their mother's milk, and nothing beats the nutrients that God and nature have provided. But we also know that milk continues to be an essential component of any child's diet to keep them strong and healthy. That's why my government had promised at the last election and in the 2015 budget to begin a program starting yesterday to give everyone Year 1 student in our schools 250 ml of free milk a day. But as I said in Voreqe this morning, I'm very disappointed that we are unable to meet yesterday's starting date for this very important program, which is designed to give our young children the best possible start in life. We are, of course, working with Fiji Dairy Limited to roll out this program as fast as we can, but we can't afford shortcuts in terms of the quality of the milk its packaging or its distribution. So we are, of course, sorry for the delay, but it is more important to get the program right, to provide the children with a boost to their health and nutrition that they need to develop their bodies as well as their minds. As I said, we need to get this right, and of course we will, and this milk will be in our schools as soon as we get it there. As I also announced this morning, the good news I can announce today is that we will begin delivering the free water we promised to low-income Fijians starting on the 1st of next month. And under this program, which was a key plank of our manifesto for the election, and is detailed in the 2015 budget, every household with a combined income of less than $30,000 a year will get an allocation of free water based on an international standard of how much water a person needs every day, which is 50 liters. Each household, based on an average of 5 people a house, will get up to a maximum of 250 liters free a day. Of course, this only applies to people who are connected to the Water Authority of Fiji. But for the rest, I can assure you that we are working very hard to get every Fijian connected as soon as possible so that they can take advantage of this initiative. In the next couple of days, you will see media advertisement urging households to qualify to register, with the Water Authority of Fiji before the 1st of the month to take advantage of this program. I urge everyone who qualifies to do so, because this is one of the most important things we are going to do to alleviate the cost of living pressures on ordinary Fijians and especially low-income earners. In this place where so many lives, new lives begin, and where a whole new generation of Fijians will be born, let us all resolve to make 2015 a golden year of achievement for every Fijian, and especially those who need our help the most. So now, Your Excellencies, ladies and gentlemen, it is my great pleasure to declare this new extension open. Thank you.
Sorry? At the moment, yeah. So they admit medical surgical cases here. And gynae.